I have a disability that has always been there. I find it hard when people don't understand or don't care.
With a feeling of proudness it may bring when putting us all under their wings. It won't be easy, but got more of a clue in understanding our lives and what we can do.
Since I started opening doors, I've gained confidence a lot more.
They've gained experience and confidence too. Their CVs will be so positive and so true.
Opening Doors is a very, very useful organisation for me as a Commissioner here in Norfolk. They give people with a learning disability a real voice.
Right, the project is about getting as many people as we can to volunteer to work with Opening Doors, which, as you know, is a self-advocacy organisation, a charity for people with learning disabilities.
They're people that haven't had experience around people with learning difficulties, and we've actually promoted them to actually come to the organisation, and so they can see what people with learning difficulties face.
And again, you would hope those volunteers are going to establish a good rapport with individuals, turns into friendship, and then it's just a natural part of support anyway. Without it, funding's then not needed, so that makes that bit sustainable.
And it just made me realise that there's that gap there for somebody to support them, and that's what I've carried on doing.
Primarily, we wanted volunteers to work with us to be part of a health project to support people with learning disabilities to access healthcare.
And so health, if they haven't got good health, often independence goes out the window.
People with a learning disability sometimes feel very nervous about dealing with health professionals like doctors. They don't necessarily like going to hospital, they don't like to go to the GPs. So having people with a learning disability as self-advocates as part of the Opening Doors project to help give that confidence is just so important.
So 10 years ago or 12 years ago, I won't get that confidence, because I mental health, I went through ill health years ago, and I won't get the confidence, I won't be as far as the management committee or vice chair to get up to vice chair. I don't think I'd got that.
There's one thing about producing reports full of figures, hard information, and of course we need some of that, but the thing that really hits home when you're talking to decision makers is the actual stories, something that they can understand, that they can relate to.
It's tricky for lots of charities like ours who do provide preventative measures, but you can't demonstrate easily what would happen had we not done. It's difficult to put numbers to things.
It basically gave me a reason to get up in the mornings and come to work and stuff. I really enjoy what I do. And before I came here, I'd never been on a bus or a train before, and I feel totally independent because now I can use the bus on my own.
What I'm looking for is positive feedback from people who've used their services, and also first-hand experience of witnessing what they do.
We have different advocacy groups. We promote people to talk up to for themselves.
And I guess I'm quite fortunate with Opening Doors is that, for example, our partnership board, where I've commissioned them to provide all of the support to the board, sometimes I'll chair the board, or I'll certainly be attending it to help facilitate it. And I see the quality of the work that's going on firsthand. How many people are turning up with a learning disability? Are they speaking up in the meeting? Are they well supported? Are people getting upset?
We should be equal, we shouldn't be separate from other people. And it's very important, I should go on equal.
We might be learning disability charity, but many of the issues we face are people who have mental health issues as well. And particularly at the moment with the cuts to benefits and everything else, there's an awful lot of anguish. So by breaking it down into different categories, you can show an increase in, and we have certainly shown an increase in issues related to mental health. and people obviously worried and sometimes suicidal, I think, as a result of things that are happening to them, money being taken away. Funding we get from the health sector is really just the Department of Health HSCVF fund. We get nothing else, unfortunately. We're trying to work with, or trying to get ourselves into clinical commissioning groups.
It's about engagement with clinical commissioning groups and having those discussions that if you invest some money at this early stage, well, you'll actually reap benefit and save money at the later stage. And they're the types of discussions we need to start to have.
GPs and clinical commissioning groups, I don't think at the moment realise the value of people with learning disabilities coming to them. They don't see necessarily the prevention, you know, how it's going to save the money.
And the Better Care Fund is about trying to reduce the pressure on hospitals and perhaps the pressure on the primary care sector too. So therefore, if the Better Care Fund plans can be linked with social care and have third sector involvement, well, with a bit of a business planning approach, one would think that that preventative work could then reap significant benefits later on.